Thank you for coming. And this is great to actually see some people in person. A lot to talk about, but probably I will start first with oops, if it's going to get moving. A big thank you. A big thank you for all of you for caring, for helping us, for making us better, for advising us, for trusting your children to us and family members to us. So we did do this for you. And I should also start with telling you what I will not be talking about. I will not be talking about the more than 70 awards that has been given to us, to various faculty and staff members, because I'm deadly afraid that I will miss someone. And it wouldn't be fair. But again, these are national, international, state, community awards, and we are very proud on all. The second is to think about this as postcards. If we would have to present everything that we do, all our activities, this would be a 6-hour presentation at least. So I picked and have chosen a couple of things, but it is by no means describing all the activities of the Institute and our wonderful, wonderful co-workers. So with that, let's get into some facts and figures. We have more than 17 disciplines. We have 5 amazing supporting philanthropic boards who we regularly engage with, and you know who they are, from the Hattie B. Munroe to the Operation Board, to Scottish Rite, to the Guild, to the Meyer Foundation for Disabilities. They are all essential for our existence. Notably, we are also one of the 67 elite centers around the country that are designated as University Centers of Excellence for Developmental Disabilities, Education, Research, and Service, or USED. And one of 52 leadership education in neurodevelopmental and related disabilities. And these are critical programs for our activities and our existence. We have anywhere from 520 to 570 employees. That's a little bit hard to count if you are looking at part-time, full-time, coming and going, but we are pretty steady on that one. Fiscally, we are very stable at the current time, which is no small achievement during a pandemic years. And frankly, in the last 7 years, we have grown probably about $5 million since I arrived. There is one notable shift that previously our clinical budget was about 50%, 51%. And now the clinical services reimbursement amount to less, but our other activities amount to more. Notably, our pot of state appropriations, seen here in green, is shrinking. Every single cycle, we have some kind of a state budget cut, which we are trying to absorb by expanding various other activities that we have. So we got more than 18 million in federal, state, and local grants, and a very significant amount of philanthropy, around over $6 million. And without that philanthropy, the Institute would be a shadow of itself. And I'm not sure how would many of our services survive. We are big. We have a lot of services. And we have approximately 90,000 clinical visits a year. And we are serving clients across the lifespan, and we serve our clients in the community. So 50% of our services is taking place in the community. Volunteering is a big part of what MMI does. And we had over 350 volunteers and more than 13,000 hours of volunteering. We are not an Omaha-based institution, and I don't know why is it not, going, this top bar is not going away for some reason. I think then click it back. Okay, there we go. So perfect, thank you. So we are not only an Omaha institution, we have 35 provider locations, and out of those, 17 are outside of Omaha with more than 50 different types of services that we provide. And we have a very active and I would say a world-leading drug therapy program, and with some 30 different programs. And we are serving a lot of families. And when you think about it, that we provide more than 25,000 hours of service, it's pretty impressive. The technical assistance is also a big part of our activities, almost 3,000 hours. And more than 140 community services were provided, and with over 7,000 participants. So these are pretty big numbers. And now it is not proceeding. So we have 4 pillars of activities: clinical services, research, education, and community engagement. And we value all of them very much equally, and one cannot exist without another. So if you look, workshops, conferences, teleconferences, and other community activities are essential for our existence and education, and we had over 8,800 participants in the last year. And by the way, this is during the COVID year, right? So, and we train at every single level, from high school all the way to the community, to fellows, to PhD students, every single level. And we have some 20 different areas and disciplines where we train listed here. About the long-term trainees and the numbers, I will talk a little bit later. As I told, all 4 activities are essential for us. Research is one of our key pillars. That what research and education in many ways, actually all our activities set us apart from a community hospital. We are at the cutting edge of science and technology, and we are actively applying for funding from outside sources. Right now, we have 56 active projects, 56. And we are continuously applying. You will see more numbers about it on my next couple of slides later. We are not only Omaha-based, Nebraska-based, but we serve our nation pretty well. This is the map of the counties where we provide services in each of the states. So some of this is telehealth, some of it is where patients are traveling from to come to us to provide our services. As a big organization, we always have leadership changes. For this last cycle, we have 4 ongoing director level searches, and I will be talking only about those ones. In physical therapy, speech language pathology, genetic medicine, and psychology. I do believe that within the next couple of weeks, we will be able to wrap up the psychology search and that we will announce a new director. Also, we had quite a few leadership positions in changes and additions to our institute. So the interesting, I'm very pleased to announce that Dr. Walter Gilliam, the director of the Buffett Early Childhood Institute, has chosen to join our faculty as a primary appointment, because the Early Childhood Institute cannot give out academic appointments. So we will be the academic home, and he's an essential, and the Buffett Early Childhood Institute is an essential collaborator for us. Shelley Westengard is the new director of occupational therapy. She's doing fantastic with new programs, expanding the programs. And so is Dr. Alice Schillingsberg, director of the Integrated Center for Autism Spectrum Disorders. With the departure of Dr. Rahman from the directorship of the genetic medicine, we are having an active search, and in the meanwhile, Dr. Lois Starr is very, very capably and just overall amazingly managing and running the department as an interim director. And so is Jessica Gormley, doing fantastic as an interim director of speech-language pathology. Angela Maynard is our new manager of the outpatient clinic, and Maggie Newjar is the interim manager of care coordination. Clinical services. Well, we are growing every one of our activities. The clinical services expanded by 21% over the last year, with a 15.7% increase at the MMI building. And these are from the MHCP contract expansion. I think that, from various sources. But I think that we should point out that there has to be always a second layer, not just expansion of services, but improvement of services. So work smarter, not just harder. And we are very much moving toward fully centralized scheduling. Okay, so I'm hearing some echo from there. Okay. We revamped the customer satisfaction survey, and which is a pretty impressive 4.7 out of 5. We need to make sure that we do business according to federal regulations, and we really strengthened our compliance monitoring. Spent a lot of time on fire drills, fire safety, and active shooter training, and we have a very detailed plan, and we feel very comfortable that we certainly created an environment that, God forbid, ever something like this happened, that we can minimize any adverse effect as much as possible. Policies are the things that guide our activities, and we identified a number of policies where we were insufficient or we didn't have policies, and we added them. We worked a lot on the different masking procedures and rules. And now this probably is in the past, but again, our masking rules always followed the need of the patient. And that was a critical thing. So even when other people were mandated to wear masks, in interaction between a child and a provider, with a provider agreement, the family agreement, and the necessity for treatment, we would forego that. We are working actively to be a basic life support and first aid training site, and that will be led by Angela. We are working to build pipelines to the clinical services in partnership with Avenue Scholars, with an idea that you want to make sure that our name is out in the community as a potential workplace and somewhere where you can grow, where you can develop a career. All these clinical services have been amazingly managed by our Associate Director and Director of Clinical Services, Amy Nordness, over there. And the new clinical programs, well, we started an autism care for toddlers clinic a long time ago. And then we had a major, a tenfold expansion about 6 years ago at 90th and Q Streets, south of us. And then about 2 years ago, we established a new autism care for toddlers clinic in North Omaha at 30th and Ames. And now we just got from Beacon some money, about $500,000, to establish a new clinic in Fremont. We are still looking for a donor to help us with an angel donor who would help us stand up the clinic. As far as the facility itself goes, we got enough money to stand up the operational and training part of the clinic. But for the physical facility, we are still looking for it. But I'm cautiously optimistic that we will be able to achieve that. We expanded Camp Munroe by a week. And that's also a big thing. The pressure is always growing on us. And it used to be that we were able to provide 3 weeks or 4 weeks of services to families. And now we are getting down that we can provide 1 week or 2 weeks. So we needed this expansion, and we are very grateful to the Hattie B. Munroe Foundation, who decided that they will fund it. Importantly, rec therapy, we had an application and we became a state-approved respite care provider, which is important. We have a new aquatic program in rec therapy. Occupation therapy and physical therapy have established their summer camps. Corticovisual assessment is a new assessment in occupational therapy. We are starting next month the epilepsy clinic, neurometabolomics clinic, and audiology. At least that is the plan. It's just administrative stuff. We have all the agreements. This is a collaboration with Boys Town. Audiology started fluency, speech language pathology started fluency services. Primary progressive aphasia communication support group. And we have now more multi-organ transplant clinic has a pediatric outpatient services that follow the procedures. Education and training is also an essential part of our activities. This is generally overseen by the Director of Academic Affairs, Dr. Keith Allen. We are sort of under the radar of most people how much training we do. When you think about it, we have 407 long-term trainees in the last year. That's a lot. And we are really an attractive place for trainees, and we filled all our slots that were available with outstanding candidates. And this is for us also a pipeline that we are building for our workforce. So we were able to capture multiple of our graduates to become faculty members with us and to stay to work with us. 5 years ago, we started a genetic counseling program from scratch. We graduated the first generation, and now we came up on a review, accreditation review. And I'm pleased to tell you that we have achieved the highest level of accreditation that is possible, and we are fully accredited for the next 6 years. And there were no deficiencies that we needed to address. Micro-credentialing will be a big push of the university. The idea is that these are micro courses, small courses on a very well-defined topic that last for a short amount of time. And these programs in general don't result in a certificate, but we result in something that is called a badge that will be maintained by the University of Nebraska system, and that you could use these badges on your job applications to demonstrate that you have a certain amount of expertise in a specific area. We are talking a lot about it over the last years, and that's a very heavy lift about the feasibility to explore a dedicated Master of Science and PhD program in developmental disabilities. So one path that we are thinking that maybe first offer a micro-credentialing, this badge in developmental disability, which would grow into a course, which will grow into a master's program and ultimately into a PhD. And I could envision this PhD program to be open to employees who actually work here, that they would also be, while working, that they would be enrolled in the PhD program. This is the breakdown of the various students and trainees that we have. And you can see that this is happening across many, many different areas. From the land certificate program to the various professional programs to the USET certificates, Integrated Center for Autism Spectrum Disorders, Mental Health Technology Transfer Center, and various other neuroscience research, a Master of Science joint with, of Psychology joint with UNO, the PhD in Applied Behavioral Analysis, and so on. So we do train a lot. So research accomplishments are many, significant, and have been masterfully and frankly have to be accredited to a great degree to Jenny Blackford, who joined us 2 years ago. She has been really taking the lead on organizing and providing structure and framework to the research enterprise. And there are some tidbits here that established the Play Laboratory in physical therapy led by Andrea Cunha, provided mentorship and training to more than 35 MMI scientists. And these are different levels. Developed an MMI summer undergraduate research program. And again, that's a good pipeline for employment, ultimately. We are working closely with the school system and systems and looking how to involve their students in research opportunities. We have multiple collaborations within the university with other academic units, College of Medicine, College of Dentistry, Information Sciences Technology at UNO. So those are also critical relationships. We don't live in a vacuum. A lot of times you need to get there is a need of the community, and there is a need of you as a researcher to have access to patients. And connecting those two is always a challenge. How does a researcher get to a patient, and how does a patient gets involved in something that a researcher wants to do? So we are very much working and established a recruitment registry to help to connect these two populations. The other thing for a success of various applications, grant applications and so on, is to know how a good one should look like. And as part of this, we created a grant repository for templates, documents, successful grants, so to give you some framework on that. And it's always helpful if someone provides you an honest feedback. And we are very much working on it. And we provided multiple peer-reviewed for applications before they go out, or if they come back and are not funded, then you discuss it and see what can it be done to improve and how do your peers see it. So let the numbers speak. Grant success rate in fiscal year 2021 was 38. Now it is 65. In fiscal year 21, we submitted 26 grants. Now we submitted 66. And again, it clearly, we are going after the money because the grants that we submitted were worth $9 million in fiscal year 21. Now they are at $21 million. And this is pretty well mirrored also in the success rate, because we got in fiscal year just over 3 million, and now we are over 6 million. So this is really a remarkable increase and turnaround in the last 2 years. Everything that we do is community engagement. It is greatly and very skillfully and compassionately managed by the Director of Community Engagement, Melanie Welsh, with a very, very great help of Jackie Hankins, and who has been also amazing in this whole enterprise and interaction with boards and just helping us taking it to the next level. And community engagement, I look at it that I put it in two buckets. One is what is our community engagement office does, but community engagement is also part of all other departments. So the Central Community Engagement was very good at partnering with the NU Foundation, and together they secured 6.2 million philanthropy for the programmatic needs. That's not a small feat. They promoted and collaborated on over 45 advocacy initiatives. And again, when you are engaging, you want to engage both internally and externally. And we had over 20 internal engagement events for faculty, staff, and students. 35 external outreach activities. And frankly, our building is amazing, and everyone wants to see it, which means that we have to give tours. And guess who is the one who has to do it? Community engagement. And community engagement gave over 200 tours of the building for the government and community. So over 7,000 social media followers. And we have plenty of press releases, media blasts, newspapers, articles about us. So community engagement is doing fantastic. And again, then, yeah, right, they get 2 pages. So the art brochure is, so our building is really a gallery also in many ways with amazing art. And we created actually community engagement and healing arts together created an MMI art brochure, which describes what are the pieces, where are they located. Every year we had previously a trunk or treat, which was held on our parking lots in freezing weather, pouring rain, and various miserable circumstances. We still had hundreds of families show up, but we tried something new this year and we organized it inside our building. And as we organized it inside our building, we had over 400 participants, and it was fantastic. And everyone really enjoyed it, and we got very positive feedback on that. We had a winter event, sort of for the holiday season, and we had Disney characters at MMI. Kids came in, took pictures. The Disney character, Frosty, was roaming around the institute even, so it was a lot of fun. We said farewell to our old building, obviously. We recovered part of our history from the old building and opened the time capsule. There are too many activities to describe about our interactions with the school system. And these are through various departments, and they occur with Millard, Westside, Scott, Madonna, OPS. So pretty much we are present in collaborations everywhere. The Go Baby Go events are adaptive cars that are adapted by our physical therapy department, and they rebuild these toy cars for toddlers who have mobility challenges and change the controls on them so they can actually and personalize the car, and so they can use it and explore their environment actively. We had 2 builds, and this is again a partnership because always a lot of the build is done actually by engineering students, and we are giving these cars away. So this is done by the physical therapy department is taking the lead on it, and they are every year, I think that now 4 years in a row, they have been doing a fantastic job. Also, adaptive toys. So some children who would like to play with toys might have certain challenges. And our physical therapy department is adapting toys so that children can adapt them to the level that the children can use them. And this is working very well. I would also point out that we have an incredibly strong relationship recently with Nebraska Department of Health and Human Services. And I have to give a shout out to Tony Green, who has been a pretty amazing partner on the developmental disability side. And again, what to say about Camp Munroe Theater Company? They are just marvelous. Those shows when they put on is just a delight. And we value very much our partnership with both Scottish Rite and Rose Theater. So, and Y Arts and everyone else. It takes really quite a few organizations to get it done right. Diversity effort. We have to be intentional about them. And we provided, and Graciela Sharif and Jackie Hankins are leading this endeavor, and they provided wonderful 4 sessions on microaggression and cultural awareness. And just the small reminders are just pretty much amazing to help us appreciate and have a different lens in life. And so, for example, an email came out for Ramadan about your coworkers. What should you be aware of? How should you accommodate them? And it wasn't in your face, but hey, just value your fellow human being. They gave multiple presentations at UNMC and UNL, provided consultation and guidance for Special Olympics Nebraska diversity policy, participated in UNMC Gender Equality Community of Practice. There was an access committee formed that will advise the director about access issues. We had an amazing invited speaker, Dr. Kia Johnson. I believe that the link is up on our website, so I would strongly recommend to check it out. And we have a diversity representative in all ongoing searches, as far as I know, in all of them, but I expect to have it in all of them, because sometimes all of us are coming from our corners, and someone needs us to remind if we don't see something the way we should see it, and that there is another perspective that should not be forgotten. COVID-19. I'm not going to dwell on it. You know it very well. What is it? What can I add to it, to all the other things? It is here. It was ugly. It is getting better. We will have to live with it, and we will have to figure out how to live with it. The masking mandate at UNMC is going away. We are becoming mask optional on April 3rd. And May 11th, the public emergency is ending, which results in interesting changes. And the interesting part is not necessarily good. We will still have to figure out what it means. Point being is that during the pandemic, we were authorized to perform many telehealth services. And now it will be a patchwork of various insurance agencies who will still allow it after the public emergency ends, and the ones who will no longer allow it and would have to bring back the patients in person to get reimbursement. And this is all something that is evolving, and you deal with it as it comes. And we will be very vigilant to know which providers are flexible and which are not. Burnout is real, present. Stress is real and present. People are working very hard. Certainly, it took a psychological toll the last couple of years working under COVID circumstances. Remember, we never shut down. And we had a celebration of excellence in person. That was a wonderful event, and everyone enjoyed so much to see each other, to hug each other, to see a three-dimensional face rather than a flat screen. We are coming up on a spring picnic, but during the pandemic, we also provided some sort of appreciation to our employees. We gave food to our employees. We provided massages. And we gave money to departments to have a fun morale building, community building, departmental activity. And those were really appreciated by our employees. But we also are looking from a different spot also, how do we appreciate the employees? A lot of jobs have only one level. You don't have a speech language pathologist 1, speech language pathologist 2, speech language pathologist 3. And so, I would love to see that every profession in our building has a sort of a career laddering, that if you are doing well, you can go to the next level, and that is appreciated. And the academic laddering for the faculty is pretty clear. It's you have from graduate student to postdoc to research assistant professor, associate professor, full professor, and somewhere along in the later stages, tenure might come in, and then you might get an endowed chair. So there is a progression. But how is it for staff? And some do have laddering in it, and some don't. And I think that we have to look systemically and advocate at the level of the university to take a look at all the careers and to make sure that we have this career laddering. And salary adjustment. We are frankly below market. And the question is what can we afford and what is allowed for us to increase. So that is a battle that is always ongoing. Other notable events, well, our building for last year got one of the top healthcare building awards in the country. And we were featured in the Healthcare Design magazine. And actually, our lobby is the picture on the front page. And this is an amazing, amazing recognition. Just as a comparison, we are the first UNMC building who ever has been even nominated on the list. So, parking, finally, after a couple of years of passionate debate and me banging on various doors and being thrown out of the door and coming back through the window and so on. So we finally got approval that we parcel out our parking lot into 2 areas. The south one here, which is closer to the building, and the one just across Exarban Drive, just across the drive that goes to Pine Street, that will be a lower cost lot because it's not adjacent to the building. And that is, again, something that the employees asked us to do. Mileage reimbursement, no movement on it. It's state policy. Every single occasion we harp on it, and it's not going to happen, not at this time. And we had a notable leadership change in the Hattie B. Munroe Foundation. And a longtime president, Steve McWhorter, basically decided to hang up the cleats. He has done amazing things for Munroe-Meyer, and we are eternally grateful to him, and left the Hattie B. Munroe leadership in the very capable, great hands of Mr. John Iliff. And we are continuing our affiliations and collaborations, and which is absolutely critical for us. Challenges. Well, that's when you push the boulder up the hill, and those are always boulders. There are always in every business boulders that go up the hill, and it's money. Inflation is very high. Cost of living has significantly increased if you just go to the grocery store. And salaries in many other sectors have significantly increased, not at our place. We managed to adjust some of the salaries for the behavioral technicians, but again, we are far from where we should be. This is compounded that we will have state appropriation budget cuts, and that is the word on the street. So we will see how much it will be. I have heard various numbers. probably in the 2.5% range, and more to follow on that one. So even that 9% that we are getting from a state will further decrease. So recruitment and retention with low salaries is far from ideal. That is always a challenge, right? We have to convince that it's not about money, but it's about work environment, and we are doing reasonably well on that. But again, it's hard to convince someone who is really at the lowest pay level when they are struggling with food insecurity and they have to have a second job to make ends meet for the family. So this is a challenge for us. You know that there is an autism epidemics in the country right now. Every year or twice a year, the new numbers come up and it's worse and worse. And right now, what we are saying is that 1 in 36, but it's 4 times more common in boys than in girls. So extrapolate to that for the boys. It's 1 in 10. So, and there are some projections already that in 25, it will, if it proceeds the curve the same way as it proceeds, that we will be talking in 1 in 20, from a 1 to 26. We shall see. Hopefully they are wrong and the curve will slow down. Employee stress and burnout is always on our mind, and we are trying to address to the best of our knowledge. And frankly, one administrative thing that gives me a lot of heartburn and is that we don't have our own tax ID. We have the university's tax ID, which is an educational institute. So when there was given out a huge amount of money, ARPA funds for the hospital systems, we were not eligible. So we lost on it we missed out on about $3 million there. And I will be chancellor. We brought it up with the chancellor, and the chancellor agreed, and the vice chancellor for business and finance agreed that we have to do something about this, with an idea that ultimately we will find a way to have our tax ID if something happens next time. And what I'm really worried about on the horizon that I can see is that all the healthcare systems that I know currently are deeply in red. And deeply in red as far as for the last 4, 5, 6 months, and they are eating up their own reserves. And the question if this healthcare system will ultimately collapse as far as reimbursement goes and cost goes, if there is another bailout, for example, from the federal government, not for banks, but this time for healthcare systems, then we don't want to be again the ones who will be on the outside. So what is the future? Well, the future for us is always grow, 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 and grow as much as you can. So all 4 pillars to grow. We want to have new interdepartmental collaborations. We want to make sure that the quality and the patient experience is there. We will consider looking at least several of the services. One, we would like to have a primary medical home. The idea is that some of our clients also get sore throat and sick ears. And someone has to take care of them. And we could be in a perfect position to do it in our building. And we are talking to the Children's Hospital and children's specialty physicians that can we make that happen. We are trying inventive ways to deal with autism services and diet services and group services. And we are thinking to start a neurocognitive assessment also in our building. Recruitment and retention will be a priority, reducing waiting lists for services. But again, the point is that the need is endless. The resources are limited. We cannot do a miracle that we will get rid of our waiting lists tomorrow. We can chip away on it to the best of our knowledge, but that's also a function of how quickly it fills up with new patients and the growing demand. And that is the challenge. Diversity and inclusion has to be on our mind, and obviously fiscal stability. So we will focus quite a bit on philanthropy, and there is a capital campaign going on. And we are raising money for endowed professorships, chairs, pilot research programs, endowment for our PhD program, for care coordination, for Caring for Champions program, and new clinics across the state. And today and tomorrow is UNMC Giving Day. And there are matching gifts, and the Wells family provided an amazing gift to us that please work unlocking it. Visit the website and unlock all the matches that are there. And there are two funds that we are targeting this year, the Unlocking the Potential Fund and the Grateful Patient Fund for Employee Support and Recognition. And understand that every dollar counts. It's not about, don't think about it that, oh, those guys are giving $10 million. No, they are one donor. And if you give $5, you are also $1. And we want to really continuously re-examine the institute finances. And this keeps, right, there we go. So we want to work smarter, not harder. The question is, where are we leaving money on the table? And can we advocate for increased reimbursement, especially for our day treatment programs? How can we reduce the no-show rates? And these are two buckets that we have to understand. One is when we cancel it for some reason, well, can we just provide another provider in those cases? Or cancellation by patients. Why is it happening? How often is it happening? We are taking a deep dive into that. Reduce what we need to write off ultimately. So we have to understand that we performed the service, we billed for it, and we didn't get the money for some reason. So why the hell we didn't get the money when we provided the services? Didn't we document it right? Didn't we get pre-authorization? What was the reason that we didn't get the money ultimately? Are we billing the right codes? Is there a better code that we can bill that would result in higher reimbursement? Stick to patient contact. I know that it's when you feel that there is the patient would benefit to spend 2 hours, but the insurance allows only 30 minutes or 1 hour. You are giving away a certain amount of resources. So we have to take a good look at that. Contracts and contract rates. We want the contract, and a lot of times we contract at a rate that doesn't cover our cost. We cannot do that. We have to make sure that if we are contracting with someone, that it covers our costs, and we will be very much monitoring this. And supervisory coding is something that probably we will not be able to get that much. That's different for different disciplines. I will not talk much about it, but the waiting risk could be theoretically also reduced by overload pay. So if someone is willing to work more and harder and stay extra hours, I'm perfectly fine that we will pass on whatever they make basically onto them as overload payment. And I already mentioned some of the services that we thought that we will grow. And those three services, neurocognitive testing and diet services, are actually chosen for an idea because we feel that we can make some margin on that. And so could we theoretically on micro-credentialing. And if this kind of move, and this would be my spiel. So with that, I'm happy to take all questions, and I can end the slideshow and let Amy come in here while I'm taking the questions. Any questions from online? Any questions from the room?
I noticed that they announced, the WHO announced this morning that the COVID shots plus COVID boosters will no longer be required for children under 5 or healthy teenagers. That's their opinion. All of a sudden, we're all
Don't
raising up.
get me started on the World Health Organization because
Anyway, it's just muddled the water big time.
Yeah, and again, after the public emergency ends, the price of the booster shots for COVID will be out of pocket change, probably $160. That's the number that we have. Yes? You have another question?
I didn't understand where that new autism clinic was going to be.
Fremont.
So
Fremont.
Do you have an approximate cost on piece of it? Do you need philanthropy to?
Say that again?
How much is needed in addition to?
About $1 million.
Another million?
Another million. So it's usually breaks down that depends obviously on the place, the venue, in what shape is it, and so on. It's about $1 million for a program and about $1 million for the venue. So the physical building to get it all basically refreshed, change the internal walls, build it out, and so on. So it's about $2 million per clinic. Now, it might be somewhat cheaper in some of the rural areas, or if you already have a space that can easily be adapted, but roughly, I would say to be on the safe side until it starts, and you have to train people and everything else. So until it becomes completely self-sustaining, between $1.5 to $2 million. Thank you very much. Any last chance for questions? Otherwise, see you next year.